Can type 2 diabetes be reversed?
Yes. Yeah, type 2 diabetes absolutely can be reversed. I do it every day. We see a couple of cases a day in my office, walk in full-blown diabetic, walk out non-diabetic, blood improving, weight improving, their labs look like a baby, like they're a baby again, right? They're looking great, kind of taking away all the damage they've done to themselves over, so many years. So yes, can absolutely be reversed.
You make lots of videos and help so many diabetics, but what makes you an expert?
Boy, I like this question. Very pointed. So what makes me an expert? Well, I think it has to do with just my success rate. I have an extremely high success rate of people that I admit into my office who've done absolutely amazing, reversing their disease, labs looking amazing, liver literally looking like like 20 years better. And I've done this a long time, and it really comes down to how I approach things, right? Like, not to say this in a weird way, but it's not that I'm smarter or better than, let's say, your doctor or a doctor who treats diabetes. They're experts at this. And they're really good. They know the medications. They know what to do to hopefully prevent a complication, which is really important. And that's the smoke, right? I'm just not the smoke guy. I'd rather be looking and finding and figuring out what causes it, and then helping someone put out those fires. And this way they can live a quality of life, right? Getting their body back to where it should be. The analogy sometimes I tell patients is kind of like an old car. Old car could run just like it left the showroom if it's being taken care of, right? If you change the paint coat every so often, if you put some air in the tires, if you polish it up. But unfortunately in our healthcare system, it's not really designed like that. It's really designed that, when something falls apart, they either find a drug for it, and there's plenty of them, or they start cutting things out or burning things out. But in my office, I want to figure out why, right? If they have a thyroid issue, well, why is that? If they can't lose weight, well, what are all the things stopping them from losing weight? The body is actually really designed to heal, right? We cut ourselves and our body heals, but what is underneath that? What is actually causing it? And that to me is just more important. I'm just kind of a fix-it guy. I don't want to sit there and put band-aids on everything in my life. I'd rather go after what's really at the root of it and see someone do well long-term, not just a quick fix. So yeah, and I just love doing this. I love helping people. So I guess that's what makes me an expert. Also, I've been on radio and TV if that's important. So anyway.
What is your root cause approach?
Yeah, in my office, we don't go after the symptoms, right? We go after the cause of the issue. So, it's funny, right? Like in my house, I have 3 kids, a lot of going on, and one of my kids is responsible for garbage. And, they're busy. They're in sports, they're in school, and sometimes they forget to take out the garbage. And I'll tell you, sometimes it smells, right? And it starts getting, nasty in there and rotting and so forth. Well, there's a couple options when you have this rotting garbage. You can go obviously and spray the room, right? There's spray, and that's gonna make it smell better, right? The room will actually smell better when that spray's in the room. Not the way I like to do it. The other thing is that as it gets worse and worse and rots and rots and rots, they put more spray and more spray and more spray. So you could certainly do that, and the room will smell better, right, with the spray, as this rotting garbage is getting, pretty decrepit and nasty. That's one option, and that's unfortunately where our healthcare system is, where they find a spray for every problem. So if someone has cholesterol, they find the spray for cholesterol. If they have diabetes, here's the spray for diabetes. If they have blood pressure, here's the spray, so on and so forth, right? Basically, they find a spray for every single one of the odors that come from somebody. I don't like that approach. I'd rather go after the garbage, right? I'd rather go and spend some time, effort, energy, money, work, commitment to grabbing the garbage and scooping it out and putting it into the garbage can and being disposed of. Yeah, that takes more work, more effort, definitely not as quick as just spraying the room. But it makes more sense. You're actually going after the root of it. So it's just about the approach.
Rapid fire question. Why do you have so much passion for helping diabetics?
Very simple. My grandmother. My grandmother, she wound up doing everything that she was told to do by her doctor. She dieted, she exercised, she took medication, insulin, heart attack, stroke, heart attack, stroke, heart attack, stroke. And she died before I was able to graduate high school. And it has impacted me ever since that, because seeing my grandmother die on a couch for 2 years, I don't think anybody should have to go through that. And the body is born to heal. And that is why I'm so passionate about helping type 2 diabetics, because I don't want anybody ever to experience that, not only for themselves, but also for their loved ones. That is why I do what I do. And that's why I love helping type 2 diabetics to not be my grandmother. The next video we're going to be going over is going to be going over diet and supplements for type 2 diabetics. All right, stay tuned. Check out the next video.